Good. Very, very comfortable with that. I mean, certainly a benefit. We want to have that internally controlled, and we want to make it appropriate. I was just making sure we weren't going to add a staff of like suddenly 20 people to save a much money, and it's going to actually cost us more money to operate that way. So very pleased to hear that. I guess that's my big questions. I was certainly an advocate of this program, certainly a tremendous appreciative of the support and collaboration between the departments and our jurisdictional partners that help bring this to a position. Now I think we're going to the process of it, and that I'll yield to Council Vice President, because this department reports to the Committee of the Whole, and this is big internal conversation that we're having at Committee of the Whole, totally appropriate from a policy point of view. Now we get to the details of should this be referred back to Ways and Means in the following cycle, and I think the impact of that needs to be addressed if we're going to slow things down or if we should follow our existing process. But I'm pleased to have all this information, and I think we've had the opportunities to have briefings from staff if there's been specific questions. So I don't want to hold up the process if that's an issue, but I will yield to the Vice President on how she'd like to handle that question going forward. Thank you.
All right, I have myself in queue, and I had a comment, and then I had a couple of questions. So the comment was really in response to the question that was posed by Councilmember Gordon about whether there should be some discussion with the Youth Coordinating Board. And I also used to be chair of the Youth Coordinating Board. I'm very familiar with it, and I do not support pausing this process to explore that. I mean, just it is a big conversation. It's a conversation with multiple jurisdictions. The whole point of the YCB is that the city isn't just expanding its own programs to serve youth, which we do have, that ebbs and flows with different budgets, but how we coordinate together with the other jurisdictions, which is the point of their cost sharing also to the YCB. So I just wanted to say I do think that's a much bigger question than what we would be able to allow time for, and I don't support pausing the process for that for those reasons. I had a couple of questions. One is maybe I kind of lost myself in the presentation a little bit, but can you go back and say, why are we confident that the 4% number is okay for year one? Because I thought, anyway, just maybe address that, or I don't know if that's Ms. Johnson's question to address. I'm asking you also.
I can certainly start, but I think that's one that perhaps Deloitte could address as well.
Okay.
We know that over time this reserve has to build. We start with a lower stop loss, right, so that we have less risk. Therefore, a smaller reserve can handle that. Hennepin County, and correct me if I'm wrong, I believe their stop loss, individual stop loss, is $1.5 million. So we're starting at $350,000, allows us to have a smaller reserve, but we are going to build that reserve, and that stop loss insurance is going to go up as we are able to take on those claims, because then we pay less. Stop loss premium is very expensive, so we weigh those, all three of those items, and that's how we come to that.
So that's kind of the answer, and I'd appreciate any comment you want to make on that, but it sounds like she laid it out. Yeah.
All right, Madam Chair. Yeah, I mean, sound actuarial projections based on the most recent 12 months claims are actually projecting the increase in claims and total cost to be less, so 1.5% or so. There's room in the budget or in the projection to put in an additional 4% and still be at an acceptable level. And especially in the first year of a self-insured program, as much that you can set aside for that reserve is recommended to be conservative to try to build that up.
Okay. Thank you. So my second question was kind of more just, I guess, tea leaf reading a little bit, but, there is a lot of talk about changes to the Affordable Care Act at the federal level. Who knows if that happens or it doesn't, but how would changes, how are we looking at whether that has impact on what we're trying to set up with self-insurance, and what risks are we trying to plan for? I mean, again, we don't know if there will be changes or what those changes might be, but I just think it's a big environmental factor. I want to know how we're looking at that.
Chair Glidden, that's something that we are keeping our eyes on a daily basis, along with everybody else in the industry. I wish I had a crystal ball to see what is going to happen, but from our review of our current situation and the fact that there have been no changes coming to the Affordable Care Act as far as the taxes and fees that are currently in the full required of fully insured plans, it looks like this is a good year for the city to self-insure because we will have that savings there. I don't know if you have any, we talk about it constantly and we are watching for that. The Benefits Labor Management Group is also very well aware and very well versed in those requirements that go along with the ACA, and we have a lot of reporting responsibility and compliance things that we do because of that act, so we are all anxiously watching to see what will happen.
Okay. And I guess part of what I'm thinking about is, are there additional financial consequences that are significant, or are most of the changes not the kind of changes that would have major financial consequences for an insurer like ourselves?
Chair Glidden, some, I wouldn't say they're significant financial, but right now we do have staff allocated for the reporting requirements, and we have to do a lot of systems work to produce the 1095 statements that go out. So if there are changes to that employer reporting that will help us, it will actually create additional money that would go into the reserves that we would have bucketed right now for plan administration.
Okay. So then I had one last question. And I will say, I feel like people are kind of asking a mix of the financial questions they would ask in Ways and Means. So maybe we'll just kind of see where we're, at. But so my other question was, and this may be kind of apropos of nothing, but so we already are we're self-insured. So we have an account, and we kind of have this mechanism, I think, where you kind of assess the claims that might be produced by different departments, and that's how they have to kind of pay into the self-insurance account. How will this be set up kind of in relationship to that fund? Is there any relationship we need to understand, or are you going to look at each department and kind of they have to,
Chair Glidden, council members, we are going to set up one self-insurance fund, so not look at it department by department. This is a citywide program, so we will have those.
I understand they're not department by department funds, but well, anyway.
Maybe I'm missing the intent of your question. Can you explain?
Yeah, can you?
So my thought was that there's a structure where we charge different departments based on the assessment of their likelihood to produce claims, and right. And so anyway, that's kind of how we set up that self-insurance fund. And I guess my question was kind of how this will affect the departments and their ability to kind of understand their costs. Is it kind of combined together in one big self-insurance thing, or it's held separately because it's just for our health insurance? Or
it will be, Chair Glidden, it will be held separately. And now I understand your question relating to budget. We budget based on a per employee premium monthly versus the claims incurred. So it's a little bit different than what we do on workers' compensation, where this is you pay a monthly premium and your claims will be paid by Medicare. We will continue that process and that type of budgeting versus anticipating a department's claims, because it won't have anything to do with that. It will be by employee, by month, similar to how everyone pays premiums right now.
Okay. All right. Thank you. I just got lost where everybody was at. Councilmember Yang.
Thank you, Madam Vice President. Since Hennepin County is here, I'd like to bring him up and ask him a couple questions. And I will hopefully just be really quick about these. First question is just with regards to the experience of Hennepin County. What were their savings initially?
Chair Glidden, Councilmember Yang. I'm Dave Lawless, the CFO for Hennepin County. With me is Michael Rossman, our HR director, and Bruce Anderson, our benefits manager. I would also note that the three of us are city residents, and we're excited that the city's taking this opportunity to save some money.
All right.
We actually saved quite a bit of money the first several years we entered into this. And the way I would describe that is for the first 4 years, we had 3 years where we did not increase premiums, and we had 1 year where we increased them 2%. We're now probably on a cost trend that's a little bit higher and probably more to market. But the savings of these taxes is a very substantial piece. Also, the transparency that you are getting from your health insurer. I mean, at the end of the day, they're in business to make money, and so they will, save the money at the end of the year. They're not sending you a rebate on that. Also, one of the other pieces that comes out of this is related to the pharmacy programs. You end up with rebates that flow back to you rather than going to Medica and so on in terms of how your pharmacy benefit is set up. So we've been very happy with this. We generated a lot of savings the first couple of years, built up reserves, and I think as was described to you, we have much higher limits on our coverage, and so therefore we have saved money on that also. But we did start a little more conservatively, similar to what the city staff is recommending to you.
So, in terms of the savings, I've heard in the millions of dollars, like over $10 million. I mean, is that even like within the realm of possibilities?
I think it's well over $10 million.
Okay. Wow, you're being very modest here.
Our program is, your discussion here is about a $60 million spend. We spend about $100 million a year on insurance. We have a larger employee population.
Okay, so over a $10 million savings. Could I ask you, just with regards to your experience, I mean, what were the lumps that Hennepin County, suffered in the first couple of years or several years with regards to self-insuring?
What losses did we have?
Were there any lumps, like, bad experiences or things like that just
we
were?
had a few transitional changes, in some cases, individual employees. Since we were changing our pharmacy benefit, we had employees who had to get new prescriptions from their doctors, and I would describe those as inconveniences rather than, significant problems. But that is the type of situation we had. We had a few cases where, as we also changed the networks we had, that some employees had to change doctors. We had a few circumstances where somebody thought that doctor was covered under network but was not. And in many cases, that was, something where the HR folks could get involved and tell the third-party administrator that's okay to pay that. We think that's the appropriate thing for the employee to do. I mean, it really brings some of that control back to the city rather than it being just a third-party insurance company. I don't think you want to give everything away to all your employees in those circumstances, but you do want to, make the decisions that seem appropriate for the employees and what's fair.
Okay. And, another question with regards to just, your experience. I mean, any lessons that you learned that you would have done differently?
I don't think we would have done much differently. I mean, I think, communication's always a challenge. I do think the concerns that employees are concerned that this means some major change for them. I think today most of our employees would say it was relatively invisible for them. At the end of the day, they're still signing up for insurance. They go to the doctor within whatever network they're in, and then the bill is generally paid by our third-party administrator. And that's how it happens.
Thank you. Thank you.
Council President Johnson.
Thank you, Madam Chair. Ms. Dennerson, do we, so we would use Medica as our administrator. Then do we, on a routine basis, do we go out and ask if other people are interested in being our administrator?
That's correct. We are required to go out for RFP every 5 years.
Okay.
And currently we have 2 years left on the 5-year potential contract with
Oh.
Medica. So for 2018, we have definitely made the commitment that we will stay with Medica and recreate our current benefit offerings. And then for 2019, that would be up for discussion whether we do an additional year or look at RFPs.
Okay. All right. Madam Chair, thank you. I really want to say that I so appreciate all the work that's been done on this with staff and then our benefits labor management committee, and not just this program, but the work that's been done over the years to keep healthcare costs for our employees at a rate that other people envy. And it may be complicated this last year when we had this choice of the affordable care organizations. It's our premiums would be the envy of about 90% of the people out here in the community. And so I thank again the groups that have worked on this, because it has saved the city millions and millions of dollars over the years in a hugely challenging environment of healthcare costs. And it's the good work of everybody that's worked on these plans that's let us keep our budget fairly reasonable for our healthcare costs when other employers have exponentially seen their costs increase. So thank you all very, very much.
Councilmember Palmisano.
Thank you, Madam Chair. Lots of things have been pointed out, so let me try to only say new things here. One is there's a lot of advantages to this, and one of them is that it really builds our resiliency as a city. We won't be beholden to fully insured offerings anymore, to prepackaged deals that are pharma plus benefit plans. And like Mr. Kelly mentioned, that means we can really start to tailor it to the needs of our employees, which are kind of unique as a city because of the many different ways that we work as a city. We're well beyond that threshold where, in terms of size, that this kind of thing, looking at self-insurance, makes sense. And I would say, instead of my colleagues seeing it more like we're becoming our own insurance company, we're really more becoming like a bank, like a fund that this operates out of, and third-party administrator continues to be our agent and continues to provide a pretty seamless thing to the employee. I've been in the private sector on these kinds of ASO plans. It doesn't seem any different, doesn't act any differently to the way fully insured plans work. I used to work in the health insurance industry. These are pretty common, especially for something our size. So I've been really encouraging of this for a few years, and I know that that members of our council that have more seniority here have been working on it as well. One of the things that I want to mention in terms of the safety of doing this is that we're building our reserves here, and that's good, and we're still seeing cost savings, and that's really a step in the right direction. I really like that you have in your presentation that you'll be providing updates for this back to council, so that as things change over time in our regulatory environment, we can continue to adjust or see if there's a different direction we can go. I want to thank this whole team for staying engaged with me. I had probably the most questions here a few years ago, and over the last couple of years, you've met with me pretty regularly, and you've made me really comfortable with your readiness to go. I also so appreciate the county's involvement. I think we should work closer with the county. We're right across the street, and they have a lot of things to share about their employees, and perhaps we have something to add to them too. The one short question that I have is, will Deloitte continue to serve as our actuaries here? Something mentioned before by Councilmember Quincy was that we're not building out our own department really, but will we continue to procure actuarial kinds of looks and services as a city?
Chair Glidden, Councilmember Palmisano, yes, we do have a contract with Deloitte where they will be serving as our benefits consultant. And we just entered that arrangement this past year, so they will be working with us on a go-forward basis.
Terrific. So I just want to say this has been a really long discussion, and I want to thank you all for staying with this initiative, because it's really some of the good work that we do in innovating our own city for the future. So thank you.
Thank you. And I'm looking down at Councilmember Gordon. Did you have some more questions?
Just very briefly, I wanted to clarify that when I was talking about Youth Coordinating Board getting involved in the discussion and understanding it better, I wasn't implying any kind of time delay or that we should derail anything in order for that to occur. It's April. It might be at least worth testing the waters and seeing if, at least getting the executive committee to discuss it at one of our meetings. Thanks.
Okay. And Council President Johnson just had a question. Is the Minneapolis Public Schools self-insured?
For healthcare?
Yes, I believe they are.
Council member or Chair Glidden, Councilmember Johnson. They are not self-insured, but they are undergoing that conversation. I know I've met with their CFO and also with Mark Ruff a couple times, and they are having that conversation.
Met Council is self-insured, if anyone was wondering that. And Dakota County.
So a lot of our partner larger jurisdictions have made that move, it appears. And I remember that, frankly, from other reports that we've had on this. So I'm not seeing other questions from council members. I wanted to make sure that we were able to exhaust those questions because it is a very, this is a big moment, despite the fact there's a lot of preparatory work that happened to get to this moment. And I want to echo the thanks that some of my colleagues have already shared to the staff who really did a methodical job, I think, of kind of going through the work, going through the options. This work really started many, many years ago, and compliments as well to the Labor Management Committee that works on benefits. I have to say, kind of over the years of being on the council, this is kind of one of the most visible, I think, partnerships that we see often in kind of moments where we're making, really important decisions that affect all of our employees, and it really gives confidence to the decision, I think, to know that there's a partnership in how to work out those details and make sure we have something that we're not still trying to work out after we make the decision of kind of how we move forward. So I just want to say I really appreciate the time that the labor management team spends on going through all these details. One last question. So I didn't see in here direction for returning to council, but I know that we talked about that. I had talked with the team about that. We had talked about the fact that this will be important to return back to council. And sometimes when you're going into a new election year, even if the people are the same, things change. And I said it's probably going to be a little bit more up to the staff to remember you need to ask to come back to the council. But I just wanted to bring that up, that we did talk about that so that we're able to kind of probably after a year or so be able to do a report back to council, make sure that we're hearing personally how is it going and those kinds of things. So I just wanted to bring that up. And I will go ahead and move this action, which again is to authorize implementation of single employer self-insured medical plan effective January 2nd, 2018, and authorizing necessary contracts to effectuate the implementation of the self-insured medical plan. And any discussion on that motion, we have the clerks weighing in on some sort of format issue.
Madam Vice President, there's a
Yep.
typo on the agenda. The effective date is actually January 1st, 2018.
Okay,
Not
so
second.
that'll be a technical correction of January 1st. Anything else? We got the proper motion. Any discussion? None further than what we've already had. So all in approval, please say aye. Aye. Opposed, and that item is approved. So thank you all very much. Third item with applause.
Chair Glidden and members
Yeah.
of the committee, thank you so much. We really appreciate your support, and we appreciate the discussion we had here today and the opportunity to present this information, and we are excited
Great.
that this is moving forward.
And I just want to make sure I thank the Labor Management Committee, and I forgot to thank Hennepin County. I really want to thank you for taking your time to be here and be available to council members, and of course our consultants at Deloitte & Touche. Thank you for being here as well. With that, I believe that we have concluded with our discussion items. We now have some reports from committees, so we'll move forward on that. Thank you. Community Development and Regulatory Services with Councilmember Fry will give that report.
Thank you, Madam Vice President. We have 18 items that are on the agenda moving forward for this Friday. Items 1 through 7 are land sales. Item number 8 is related to consuming alcohol in the Commons Park. Number 9 is a refunding of bonds and a passage of a resolution approving the issuance of revenue bonds by the City of Landfall Village. Item number 10 is liquor business and gambling applications. Number 11 is the contract for Upper Harbor Terminal redevelopment. 12 is a contract for amendment for option agreement with United Properties related to the Nicollet Hotel block. It's an extension. Item number 13 is the passage of a resolution authorizing the submission of 2017 Hennepin County Transit-Oriented Development Grant applications for Hennepin County. Number 14 is a grant acceptance for deed. Number 15 is the Great Streets Business District Support Grants, and that will actually be coming back to the committee. And I'm sorry, it won't be coming back to the committee, but specifically we're going to have there's a change for the Northeast Minneapolis Chamber of Commerce from $24,300 amended to $27,600. 16 is a rental dwelling license reinstatement. 17 is a license settlement conference recommendations for relating to Certix, which has been recommended to be held for 2 cycles. And then 18 is the 2017 Metropolitan Council Livability Communities accounts and grants. Happy to stand for any questions.
All right, I'm not seeing questions. Next, we have Health, Environment, and Community Engagement. Councilmember Gordon.
Thank you, Madam Vice President. The Health, Environment, and Community Engagement Committee is bringing forward 5 items for consideration. The first is passage of the short-term food ordinance amendments. Second item is approving a contract with the Family Partnership for Sexual Trafficking Victims. And the third is authorizing an agreement with Health Partners for school-based clinic insurance payments. And fourth is grant acceptance from the Mississippi Watershed Management Organization for summer interns. And the last is approval of the Minneapolis Green Zones resolution. I can stand for any questions.
All right, I'm not seeing questions. Next, we have Intergovernmental Relations Committee. And for that, we had a couple different items. One was we had action taken to draft letters, one being to the Minnesota Congressional Delegation regarding the President's 2018 budget, and I believe that's attached to the agenda now, so council members can review that. We wanted to make sure you had an opportunity to do that. The 2 other letters are in accordance with otherwise adopted policy positions for state legislative action. One is a letter regarding transit and transportation funding, and the final one is regarding funding of racial equity agenda items. And then item number 2 was passage of a resolution supporting continued funding for the National Endowment of the Arts and the National Endowment of the Humanities and opposing defunding of those agencies. And I'm not seeing questions on that. Next, we have Public Safety, Civil Rights, and Emergency Management with Councilmember Yang.
Thank you, Madam Vice President. On Friday, we will have 4 items for approval. The first item is a revised comprehensive general emergency management plan. The second item is an agreement for jet patrols for the summer. Third item is a cooperative agreement between the Minneapolis PD and other law enforcement agencies for the Super Bowl. And the fourth item is a contract with Hennepin County Community Outreach for co-responder pilot program. And I will take any questions.
All right. Not seeing questions. Next, we have Transportation Public Works with Councilmember Wright.
Thank you, Madam Chair. The committee will be forwarding 24 items for consideration at the full council. All items pertain to projects in the right-of-way consistent with the season. 2 items are about the PV Plaza and the Commons Park work. And then of course, a series of procurement approvals, all low bids. The only highlight I would point out would be the last item, which was the 2017 International Compost Awareness Week, which we recognize. And of course, there's a great report on all the activities the department's undergoing with that program. I'll stand for questions.
Thank you. Next, we have Ways and Means with Councilmember Quincy.
Thank you, Madam Vice President. Ways and Means will bring forward 10 items for consideration on Friday. We have 2 legal settlements, 2 grant acceptances, low bid for a convention center lighting project, as well as 2 contract amendments. Of particular note is item number 6 on our agenda. It's the annual rollover of funds from 2016 budget to this 2017 budget. It follows a set of criteria that funds those ongoing projects. So that's good news. We were able to do that, as well as Item number 7, we're authorizing an issuance of an RFP for architectural and engineering design services for the Consolidated Office Building Project. And the final item was number 10. It's the agreement with the 2018 Super Bowl 52 Host Committee for a list of city services that will be repaid by the host committee, but that's the outline of the anticipated costs to host this world-class event, as well as what we're going to be reimbursed for. So just wanted to highlight those 3 items and look forward to any other questions.
Thank you. Finally, we have zoning and planning with Councilmember Bender.
Thank you, Madam Chair. We have 4 items this cycle from zoning and planning. Item number 1 is approving a small yard variance appeal for a garage on East Lake of the Isles Parkway. Item number 2 is a rezoning for a planned unit development on James Avenue North. It's adding a transitional parking overlay district. Item number 3 is a rezoning at 3241 Cedar Avenue for 3 residential uses within an existing building. And item number 4 is passage of an ordinance amending our zoning code about regulations for fraternities and sororities.
All right, thank you. And with that, I believe that we have concluded with our agenda for today, and we are adjourned. Thank you.